I'm Gerald Keasling. I'm a physician in Fremont, Nebraska. Been practicing for just under 32 years here in obstetrics and gynecology. We like to see our patients initially around 8 weeks of pregnancy. But the initial evaluation includes blood work, which checks for sexually transmitted infections, gonorrhea, chlamydia, hepatitis B, and syphilis, and also HIV. We screen during the pregnancy for gestational diabetes. One of the most important things is to know what their due date is. If somebody comes in very late to us, we don't have any way of knowing that. A lot of women don't know when their last period was. If you do an ultrasound after about 20-24 weeks, they're not very accurate. We check for anemia, blood pressure, and hypertension. We also check family history, make sure that there is no history of any genetic diseases that we need to screen for during the pregnancy. A lot of these things need to be done early in the pregnancy to be accurate. We had a patient in the hospital the other day who was having problems with a non-pregnancy related issue, and she was in the neighborhood of 33 weeks along. She'd gotten her letter and she wanted to be sure she got delivered before March 1st so that she had coverage. Well, she would have been 5 weeks premature at that point, and there's no way that that could be done, but that's the mindset of somebody who gets a letter like that that tells them that they're losing their coverage. They want to be covered if possible. We've had people that are just afraid to come back in anymore for the rest of their pregnancy because they're not being covered, or they have been told that they're not going to be covered. So there's been a lot of anxiety in our Medicaid patients, not just our undocumented, but a lot of people who got letters that were U.S. citizens or had their green card and were legal aliens. The undocumented aliens, their child, when they're born, by the 14th Amendment to the Constitution, they are citizens. And they are eligible then for Medicaid. Well, if they're going to have Medicaid at that point, they might as well be healthy when they're delivered. It would be nice if they were less premature or not premature, had less complications, but that's something we won't have the control over if they don't come to us. The Institute for Medicine estimated that an average cost for neonatal care for a premature infant in 2006, I believe it was $51,000. That's an average, but that can vary up to several $100,000 on the very premature for the ones that are sick. So it doesn't make a lot of sense to allow people to be delivered in an unsafe situation and have to pay for that. And this $51,000, I think, was an estimate just for the initial hospitalization. These babies will have a lot of medical care that they need throughout the first year, possibly throughout their whole life, that they would not have had to have had if they'd been born healthy. I think Nebraskans feel that we are a right to life state, and I think the right to life means right to a healthy life. I think all the people that live here deserve the opportunity to have their children born healthy if at all possible. It won't happen to everybody, but I think the lack of prenatal care is certainly going to decrease our ability to have healthy infants born that are U.S. citizens.